Patients are always concerned about whether they actually need chemotherapy. So let's take a moment and talk about who is the ideal candidate for systemic therapy. The decision to offer chemotherapy to a patient is dependent on many factors, most importantly, the stage of the tumor at the time of diagnosis. It's also important to discuss with the patient the goal of the chemotherapy. In early stage disease, stage 1 through 3, the goal still would be curative, meaning that we try to cure the patient with a combination of surgery and chemotherapy. In stage 4 disease, meaning the tumor has spread to other organs, unfortunately, in most cases, the goal of chemotherapy is to extend survival. But it's important to note that chemotherapy will improve the symptoms of the patient, it will lessen the pain, it will increase the energy if the patient has a lot of disease. And it's important to note, in the right center, with the right multidisciplinary group, there is a subset of patients with stage 4 disease that will have long-term survival and even cure if treated with a combination of chemotherapy and surgery. Let's go back to the early stage disease where the goal is to keep the cancer from coming back. If you look over the past decades, we see that mortality or cancer death from colon cancer has dropped by about half. While part of it is due to early screening and more people getting screened, part of it is due to improved chemotherapy that we have to offer the patient, especially in early stage disease. In stage 3 disease, meaning tumor that has spread to the lymph nodes around the colon, it is very much standard today to offer a 6-month course of 1 or 2 drug regimens to the patient in order to decrease of the chance of the tumor coming back. The benefit of the chemotherapy in this setting is the greater, the higher likelihood of the cancer coming back. There are factors that are determined by the pathologist, such as did the tumor invade the lymphovasculature, did the tumor invade the neurons around the tumor, how many lymph nodes are involved, how aggressive does it look under microscope, meaning does the tumor look more like colon cells or like something completely else. So when we determine the necessity for chemotherapy, we take all these considerations into together to make a determination. In stage 2 disease, meaning the tumor has penetrated through the colon wall but has not metastasized to the lymph nodes yet, the decision whether to give chemotherapy is more complex. And it's even more important in that setting to have a conversation and discussion with the patient goals, the patient's values, and how much risk and benefit the patient is willing to accept for a possible benefit of chemotherapy. Because we know, if anything, there is a very small benefit of chemotherapy in stage 2 disease. In stage 4 disease, as I mentioned, the majority of the patients will have significant survival benefit when they go sequentially through different treatment regimens we have to offer them. There will be anywhere between 10 to 20% of the patients who have maybe only 1 or 2 nodules in the liver. These patients, especially if younger, are excellent candidates for curative intent treatment, meaning we give them 3 to 6 months of upfront chemotherapy, shrink the tumor, and then take them to the surgeon to remove that half of the liver. Sometimes this is also possible if the patient has only 1 or 2 nodules in the lung, although this is less common. So while for the majority of stage 4 patients, the goal is to extend their lives, there is a subset that actually might be cured.
For an interactive tool to learn more about your colon cancer and your personalized treatment options, go to mycoloncancercoach.org.